I'm sure that many of you heard the saying, you are what you eat. And if you're an athlete, you probably know that food is fuel, and you perform better when you have the right nutrients to fuel your performance. From prepping food to cooking to working with medical professionals on nutrition plans, dietary aides and registered dietitians play a critical role in our health and wellness. Let's find out a little bit more from BJC HealthCare.
Hey everyone, my name is Devin Murray and I'm a registered dietitian with Bjc School Outreach and Youth Development. I'm so excited to join you today to celebrate your 2022 Healthcare Career Day. I hope you're learning lots about all the different types of healthcare professions that are out there. So you're probably wondering what a registered dietitian is, and essentially what we are is food and nutrition experts. So we really specialize in being able to translate the science of nutrition into practical solutions for healthy living. So as a registered dietitian for BJC School Outreach and Youth Development, our work really specializes in working in our community. So I'm a community registered dietitian, specifically a community health educator. So our role really lies in educating youth, so anywhere from K through 12, about how the foods they eat and the drinks they drink affect their bodies. We also specialize in fitness curriculum as well. So we teach kids there's the power of movement and how movement and exercise and physical activity benefit our bodies. So now you know a little bit about what a registered dietitian is and what I specifically do at BJC. We're gonna show you a little kind of day in the life of the types of programs that we teach. So even though I'm employed by a hospital, we don't do too much work inside of the hospital. You can still find registered dietitians in the hospital setting, and that would be more clinical nutrition. So if you like working one-on-one with patients and doing more bedside work with them and teaching them more medical nutrition therapy, so how the foods they eat could impact a certain medical condition that they may have, that would be a really great route for you. Another great route could also be into food service. So anywhere that there's food being sold or distributed, like grocery stores, big cafeterias, you'll also find registered dietitians there too. So my favorite thing about being a registered dietitian is just the variety in the job field that you have. So you will never get bored. You can always kind of switch it up and find a new challenge, even doing the same career. One of the main things that I love about being a registered dietitian and working with youth is helping people create healthy habits at a young age. As we know, we are bombarded with messages in the media when it comes to fitness and nutrition, and what may be helpful to you might not help somebody else. So it's a very individualized type of healthcare, and that is my favorite thing, is being able to work one-on-one and even in group settings. So you get a little bit of both of that as a community health educator, and just being able to see the impact that you make on people just to help them live better and healthier lives. Thank you all so much for joining us today. I hope you learned a little bit about what a registered dietitian is, and maybe you are interested in that healthcare career now. It's a super rewarding career, and it's always challenging, and there's a lot of room for growth in being a registered dietitian. If you have any other questions, feel free to reach out to us at BJC School Outreach and Youth Development, and we would be more than happy to answer them. Take care.
That was good insight into the world of dietitian and nutrition. And with us today from BJC HealthCare is Devin Murray, community health educator, as well as Denise Strelo, manager of community health impacts, and Terry Hart, manager of workforce diversity. Thank you guys for joining us.
Good morning. We're happy to be here.
So Devin, just want to mention, we saw time and time again in the Olympics how nutrition played such a critical role. It sounds like you're a busy person when it comes to nutrition and trying to, fuel not only sports teams but individuals that are trying to heal.
Yeah, definitely. The really neat thing about being a registered dietitian, you saw a little bit in the video, is we can work in so many different fields. They'll be needed everywhere. Our work really lies in working with students from kindergarten to 12th grade. So I focus a lot on, just educating our youth in our communities about how the foods they eat impact their bodies. But there's definitely sports dietitians. You can work in research. There's a lot of different options for you. But I'm going to hand it over. I think Terry's going to share her screen and talk a little bit more in depth about just different careers in BJC as well.
Absolutely. Thank you, Devin, and thank you for letting us know that nutrition is important at any point in our lives. Welcome. This is an overview of BJC HealthCare, and just want to talk to you a little bit about what we do. My name is Terry Hart. I am one of the leaders in our diversity, equity, and inclusion space, and I have a strong experience in human resources. That's my background. So what I'm sharing with you today will kind of be from that perspective as well. For those of you who do not know, we have 15 hospitals and service organizations under our umbrella. So most people know us as maybe one of these hospitals you see on the screen, and all of those hospitals roll up under the umbrella of BJC HealthCare. So just so you know, when you see those names, we all belong to BJC HealthCare. Next slide, please. I'm going to talk to you a little bit from a perspective today of culture, career, and community, and I'll mostly focus on culture and career. So a lot of times we talk about careers, and we're going to do that too, but we want to talk to you a little bit about culture. I was watching as you were talking in the chat today, and while that is really a part of culture, you are talking to each other, talking about what you want to do, sharing in this space. And we do that too. I felt like I was in one of our morning meetings. So I'm going to talk to you a little bit today about the culture at BJC. Next slide, please. So one of the ways that we do that is that we connect through what most organizations refer to as employee resource groups. A lot of connection with your friends and folks that you go to school with. We do a similar thing in our organization, but we call that BJC Connections because we feel that connecting with each other, connecting with people that are like us, people that have similar interests, people that we can learn from, people that we can be allies to, makes us a better organization. So we have like 8 groups in our organization who come together and talk about our culture and what they can do to make it better. So if I am a member of the Diverse Nurse Connection Group as a nurse, I connect with each other and we learn how to treat our patients and families that are different from us. If I am part of the LGBTQ Connection Group, I know that there are people in the organization that represent just like I do or other people. And so we want to make sure that we make a space for everyone. So connection is really important to us. And so when you think about the culture of an organization and where you want to live your career, I encourage you to think about those kinds of things. Next slide, please. And not only that, we talk about the whole person. So we have, as a part of our offering to our team members, is something called Thrive. Sometimes we can't work in an organization when we're feeling bad ourselves. We just went through a big pandemic, and all of us experienced many things that you see on this screen. Our mental health was compromised. It compromised our money situations. We needed to stay well, right? We needed to stay well to be in school and to be with each other. And as Devin shared with us, we needed to eat well because that helps us be better at what we do. And so all of these things are what we offer to our team members as a way to make sure that they can bring their whole selves to work and that we care about them as a person, not just about an employee. So when I talk about culture and connection, that's what we're talking about. Before you can even do your career, you need to feel good about yourself and the people that you're sharing in that space with. So we wanted to tell you just a little bit about what culture means to us. Next slide. And then we focus on our career, right? So guiding people to success. We are all familiar with that GPS concept. It gets us to our destination. And we use that concept to help our team members manage their careers within our organization. You've heard about many careers already today. And how did people get there? What did you need to do? What was that map that took you to the job and the career that you wanted to have? Next slide, please. And so we have this mapped out for career exploration. We have it mapped out for our team members to say, if I start here, I think I heard a question or saw some things in the chat. If I start here, how do I get to the next place? And so we do this for our employees with each of our positions within our organization so they can understand, if I am a patient care tech and I want to be a nurse, what do I need to do next to get to that? And if you see all of those little stars, you can click on those and it kind of tells you the path that you should take. And this is external to our organization. So if you go on our BJC website for career exploration, you can see this as well. So it is also open to the public, but it is really a good place for us to help people find and navigate where they want to be. Next slide, please. So if you see, this one starts with patient access. A patient access representative is one of the folks that you see when you come into a hospital, and they kind of guide you to where you need to be, or you talk to them on the phone about your bill, any of those kinds of things. But our system is set up that when our employees or our external folks click on that link, the little button, it will tell them what they need to do. And again, how do I get to the next level? You can start as a patient access 1, which is kind of the entry level. You can advance to a patient access 2, but then where can I go from there? Can I stay on the clinical side? Can I go on the financial side? This is how we navigate our careers. As someone alluded earlier, healthcare, I call it a little city. It has every kind of job that you can imagine within healthcare. Sometimes our minds go to just clinical, but we are a young city within itself, and we have just about every position you can imagine within the healthcare field. Next slide, please. And so I wanted to kind of share that in a snapshot. We refer to all of that as our total rewards. So when you think about coming into an organization, what the culture is, what my career is, and what benefits does it have to offer me, that is a total reward package for anybody coming into the healthcare field and spending their time and energy and developing their career. We want to make sure that you're a whole person in addition to your career. And I will turn it over to my colleague and friend, and so we can move on.
Hello there.
Denise, is Denise there?
I'm Denise Strelo. I'm the manager of community health improvement. I am also a dietitian. I started my career in healthcare a really long time ago as a registered dietitian. Is there another slide beyond that one?
Yes, next slide. There we go.
Okay, maybe skip to the next one. So our mission in the School Outreach and Youth Development team at BJC HealthCare is to empower young people of all ages to make the best possible decisions, whether it's about their personal health, their safety, or their healthcare career exploration. Next slide, please. In School Outreach and Youth Development, there are 3 areas that we focus on. health education prevention programs. So we present programs in schools to youth who are in kindergarten through high school. We also do community engagement, which is the third box on there. And that's working with our communities, coalitions, different community members, rec centers, community centers, different neighborhoods to bring in education that they might need, or to help with making changes in policy. Maybe it's reducing barriers to getting healthy foods or getting physical activity on the playground at a school. The third box there is what we're here to talk about today, and that's career exploration. This is an area that we focus on because we believe that young people need to have options. They need to have choices. Each of you are here today listening and paying attention because you're interested in what kind of job you're going to have. And at BGC HealthCare, that's one of the things that we're interested in too. We're always looking for new employees. We always have a lot of openings. Terry just went through all of the great benefits that we have, and healthcare is an ongoing, wonderful career. Next slide, please. So if you are interested in learning more about what we do in school outreach youth development or BJC Healthcare in general, we have a centralized program line, and that number is on your screen, 314-286-0460. Or you can reach out to us at bjcschooloutreach.org. We want to thank you for your time today, and we want to answer some questions if you have any for us. So I believe Devin will be back, and Terry and I will be around to answer some questions. Thank you so much for your time.
Great. Thanks, Denise, Terry, and Devin. Really appreciate the insight into registered dietitian. We actually have one question that came in. So Maya is a clinical dietitian with a master's degree and 14 years experience in their country, but they're now here in the US. What is your advice to them? They're a student now at St. Charles Community College. What is your advice to them to getting in the field right here in Missouri?
You want me to kick it off?
Sure.
Yeah, I would say Denise has a lot more experience than me, so I know that she can probably piggyback off of this too. But just kind of getting set in the field, I would say first just start off with like narrowing down what your specialty wants to be. So do you want to start with clinical? Do you want to get into community, or do you want to go into food service? Kind of narrowing it down there, because like we said before, being a registered dietitian, there's just so many different options and specialties that you can get into. And then just kind of looking at places, you know, that are hiring, and also just making as many connections as you can with a place that, you know, what you think would be like of best interest to you.
I would add to that, connecting with people that are in your neighborhood or your community or at St. Charles Community College, reaching out to a friend to learn about what they do or what kind of jobs are available. That is a great way to get started. We had a young woman who was relocating a few years ago. She wasn't sure what she wanted to do, and she sent me an email and said, "Hey, I think I might want to work at BJC, but I don't know what you guys have open." So we've actually stayed friends over time. She never did come to work here, but she's now working in public health. So it's making connections with people who are similar to you, but who are also different from you, that might be able to lead you in a different direction if you know what direction you think you want to be in. Terry, do you have anything else for someone who might be interested in coming to healthcare?
Yeah, from an HR perspective, I would say go onto our website and look and see if there's any openings in that particular field. And then maybe we can connect you with somebody in our St. Charles community, one of our hospitals, Progress West, to maybe even learn more from somebody that's doing the work out there as well in your community. So, yeah.
Great answers. And we have time for one quick question before we zoom on to our next segment. Phoebe wants to know, what made you realize this career was a good fit for you? Devin?
Yeah. So I always knew that I wanted to be in healthcare. I kind of grew up in an environment that fostered that idea. So both my parents were in healthcare. I originally started off with just thinking about being like a physical therapist, actually. And I started that degree and realized it was not the fit for me. So I would encourage you to, even if you think, you know what you want to go into, to still be open to other ideas in healthcare. I took an introductory nutrition class, I think my sophomore year in undergrad, and it was kind of a light bulb moment for me where I just felt immediately like, you know what, like truly this speaks to me. I feel like I'm more passionate about this and I can help people better going down this career choice, because I always say we all eat food, we all drink drinks, and we all need to move our bodies. So it really just applies to everybody. And I'm like so happy that I decided to make that switch even 2 years into doing physical therapy, because I wouldn't, change a thing about it. So
That's a great answer. I'll piggyback on that as well. I started off as an accounting major because I thought I could make more money as an accountant. What I realized is I didn't really like all those numbers. I took an introductory nutrition course, and similar to Devin, I was fascinated by nutrition and how important food was and how exercise and nutrition impact our bodies. And I was an athlete in high school, so it really made sense to me. And I changed my major as a junior, and then I did an internship and moved to St. Louis and worked on my master's. So there's lots of opportunities out there. Even if you start in one field in college and decide that you want to do something different, you can always change your mind. I've had a lot of different jobs over time, and they've all centered around nutrition, physical activity, and improving our health. Terry, do you have something to add?
I'll say from a different perspective, my background is human resources, and I grew up in a medical family. My mom was a medical secretary, so I grew up with her and the physician that she supported. So healthcare was what I knew. But I could do HR anywhere. But when I thought about, at the end of the day, for any organization that I work for, I want it to be meaningful. I want them to do something that gives back to our community. And so healthcare was a choice for me because I could be in a space that I knew and understood and do what I do. I won't get it twisted. I can't touch patients, but I can help the people that do. And I so love what I do.
Well, great parting shots. And thank you so much for being here today, BJC Healthcare. We've really enjoyed your time. And we know that students are going to go onto BJC's website and check out some job opportunities today. Hopefully sign up for a new position there at BJC. Thank you for being here.